Hi, my name is Molly Lindquist, and I am a 11-year breast cancer survivor.
Hi everyone, I'm Samira Daswani. I'm a 3-year breast cancer survivor.
And we are pitching a panel for South by Southwest that talks about the rise of ChatGPT in the way that patients and doctors interact with each other, which is something we're both very interested in given our cancer histories.
And we have already used ChatGPT numerous times. And we are the self-proclaimed patients from hell who show up at the doctor's office very prepared with a lot of questions. Thus, we are proposing this panel to have the two of us, including two oncologists who are world renowned, to join us and discuss the role of ChatGPT in the future of doctor and patient relationships, specifically in oncology.
And Samira, I know you recently actually had to go in for an infusion, and I'm just curious, how you got information about what drug you were going to use, what the process looked like, how that experience was for you.
Definitely use ChatGPT. I am one of the 97% of patients out there who rely on Dr. Google, and now ChatGPT seems to be replacing Dr. Google heavily in the discovery of what basic terminology is in medicine, how to better understand what the clinician is going to be talking about, how to understand what medications I was going to be getting, any pre and post infusion support. So I know it's become a fairly regular factor in my medical life and not medical life, but very heavily medical life. How about you, Molly?
Well, I'm 10 years ahead of you. So, back in the day, the good old days, I actually relied heavily on Facebook, our good friend Dr. Google. And let me tell you, I went to some places in the internet that someone who's in a very vulnerable place and has just heard the words, I have cancer, does not want to be going to. So, it was definitely kind of an information jungle out there. So,
Yeah.
it's very interesting to see how ChatGPT is impacting that experience.
I, on top of our sort of experiences with Dr. Douglas Blaney and Dr. Don Dizon, I'm sure we're going to unpack the impact it's had on them as well as oncologists and the practice of medicine. Because secretly, and we can ask them, I'm sure they use it too in navigating their own life and maybe our medicine. But more important than that, I think it does change the dynamic between us patients, you 10 years out, me today, in how we interact with them and how they might interact with us. So these are just some of the topics that we are looking to cover on this panel.